name is Chris Thorson. You notice I brought a wheelchair with me. I'm a physical therapist, and I work at Millard One Rehabilitation, which is an inpatient rehab center, and I specialize in spinal cord injury. So I figured I'd bring something with that's kind of cool to show something very unique that I do. I just want to show you briefly the goal of what we're going to be doing with wheelies, and then I'll talk about, actually I'm going to ask you guys why in the world I'd be doing that. Oh yeah, thanks. Getting to the point where you can control a wheelie, move around, spin in a circle, move forward and backward. All right. Quick question, why in the world would I be doing that with my patients after they just broke their back? Any thoughts?
For trust.
Trust is part of it. With the mobility part of it, when you look at outside, Minnesota, well, anywhere in the north area, Minnesota, Wisconsin, Michigan, frost heaves. Does that keep sidewalks level? Thresholds into and out of houses. Is that easy? Are they totally level and easy to get over? No. Curbs. When you're out with your buddies and you just got a spinal cord injury, the first thing you want to do is just hang with your buddies. You don't want to go to the end of the block for the curb cutout when they're just cutting across the street. You want to be able to pop a wheelie, roll over that curb, keep cruising, pop a wheelie on the other side, come up and over that curb. I actually teach some of my patients to do that. It's a really cool job. So that kind of gets to that point of thinking outside the box of what do we need to do for our patients to help them be more mobile, to be more independent. Get into that specialty area, you want to be prepared. I needed to master wheelies if I'm going to teach people how to do them. We're also looking at the basics. When they first get there, how do you get in and out of the wheelchair? How do you move your body around when you have only your arms to work with? I'm going to hit in on their scapulas and their chest. And then we're going to make sure that they're doing it in a biomechanically correct pattern so we're not getting repetitive use injuries. So there's a lot of communication, a lot of working together, and working with the patient. Sometimes you're getting these patients at probably one of the lowest points in their lives. And what a cool part, while it is not fun for them to go through that, how cool for us to show that you can get back to everyday life, you can get back to being involved in the community, you can get back to work, hanging out with friends, doing anything that you were doing before. I've had a few former patients that said, since they were injured, it's opened up more doors for them. They are more involved and more active than they were before because they saw the opportunity with it and they decided to go with it. And that, I got to be part of that. There's a lot of opportunity again. When I first went into physical therapy, I thought I was going to be in sports medicine. Thought for sure. Figured out, I'm going to go try to work for the Minnesota Twins someday. One of my instructors at school really encouraged me to go on a clinical where I work right now. And I worked on the brain injury team. And I thought, I do not want to be on the brain injury team in a neurological place when I'm going to work in sports. Best thing I ever did. Be prepared to step outside your comfort zone with any of your health careers. It opens up all kinds of great opportunities. You can find something you didn't even know you loved that much. I haven't been out of school that long. It's been almost 15 years, but it's long enough that I had some people that kind of emphasized, like they thought, don't get too emotionally attached to your patients. I couldn't disagree more. I think that's a really bad idea. I think if you can emotionally connect with those patients, that allows you to have that trust factor. As far as those challenging times for motivation, people are allowed to have bad days. And sometimes it's just saying, it's okay you have a bad day. That's just fine. Sometimes it's finding those unique ways to motivate them, find something personally relevant, and being able to get that connection. It's a major art. I will say that I know that I had classmates in school that were much more knowledgeable than me and probably had better hands-on skills, but I know that the art of being able to handle those interpersonal communication skills is going to help you excel further than clinical skills for many situations.